Hi, everybody. My name is Carlota. I'm the nursing director for the sexual health clinics in New York City that are under the Department of Health and Mental Hygiene. And so I currently oversee the 15 nurses that work for the DOH sexual health clinics. And we previously had 8 clinics open in all of the boroughs. And at this current time, we only have 1 clinic open, and that's our clinic in Chelsea. And so we've gone from seeing about 9,000 patients a month when prior to the pandemic to currently seeing anywhere from 5 to 6 patients a day. And we've just completely changed the way we're seeing patients and what patients we are seeing for sexual health. I mostly am working here in the Chelsea clinic right now and trying to be like a supportive, making like new protocols and new policies and procedures because we're changing the way we interact with patients just to try to reduce the risk to nurses and our staff here. And I haven't worked directly specifically with the COVID response, except for a short period of time where I was at the Javits Center working on the evacuation call center, where I was helping the call center, just what the goal was, trying to get patients that any hospitals that were like over flooded or having like a very high patient census, trying to see if we could get those patients over to the Javits Center just to relieve some of the pressure on these hospitals that couldn't handle the capacity that they were at. And that's a little bit about me.
Okay. Hey, everyone. I'm Julian. I work for the Department of Health as well. My title is City Medical Specialist, but I'm an internal medicine trained doctor. My normal job is as the physician in charge of one of the 8 sexual health clinics that the city has. But everything changed pretty dramatically and abruptly at the beginning of March. We're basically in a matter of days, we went from working at full capacity, seeing hundreds of patients a week, to basically they started to have to close our clinics to consolidate our staff. And then basically staff were like switched around. Some people were switched to go to the labs. Some people were switched to go to other sites to work. And some of us were, my initial role, I've had a couple roles since I was activated for COVID. I was doing case investigations early, where we were basically tracking down anyone who may have come in contact with the known case really early in it when we had like a handful of cases. But each day, as the numbers were increasing so much, it got impossible to kind of trace contacts. We'd be calling, thousands of people. It was impossible to do that. And so then I got activated for basically this hotline that's like a provider access line. And basically now, 3 to 4 days a week, I'm answering phone calls from not direct patient care questions. Like, I'm not talking to patients, but I'm basically talking to healthcare facilities and like ambulance services and nursing homes and acute care rehab centers, and just literally walking them step by step to how they can get their facilities safe and manageable in this crisis. Because I don't know, as many of you know, like some of these types of places are where it, if it gets in there, it spreads like a wildfire. And so it's like a weird, we work in public health. And so we're definitely like essential and like first line, because we help the people who are seeing patients in direct care, but we're just like in a different capacity, in this response, but all pretty necessary. So moving on, I guess, why are we doing this? So a few weeks ago, pretty early in the response, when I was talking to people, when I was making phone calls, I realized that so many people had so many questions and had no one to turn to. We were getting a lot of phone calls and people were just scared to death, and all they saw on TV and heard on the news was like, this thing is coming, people are dying, if you have the symptoms you have to stay home, and people were just so scared. And so then I basically was just talking to Carlota, and I was just like, I just wish that there was some way for people to just get the simple answers, because knowing, from our daily work, we know a lot of people don't have healthcare and don't have health insurance. And our clinics that we work at, they're free, no money, no charge, nothing. And so knowing that we have capacity to see thousands of people in a month, knowing that all those people are out there dealing with this, without insurance and not without a doctor to reach out to, we were just like brainstorming, thinking of like how can we like get the message out there. So we did our first like Instagram live chat about 4 weeks ago. We had a pretty good turnout, like 160 something people tuned in. And since doing that, I've gotten a lot of feedback and a lot of, text messages and direct messages from people, saying that they really appreciated, us taking the time, to talk about things and like organize, figure out a way to like let people ask their questions in a non-judgmental way. And that just let me know and reaffirm that like this is something to keep doing. So when Naomi or Sachi reached out to me to, for us to kind of extend this to the 8-ball community, it felt like a natural fit just to like, let people have more access to, good sound advice that's coming directly from the source. I'm at the health department working on this thing on a day-to-day basis. I'm paid to basically know what's going on out there. And so, so here we are. So we had a few questions that came in earlier. One sec. And a few of the questions kind of all hit on similar topics. At this point, we're all in this. We've been in it for, a few weeks now. And so we're beyond the hysteria, everyone's scared, what do we do phase. Well, the early part of that. And now we're just trying to like manage, maintain, and just figure out what the hell is going on. So a lot of the questions that came in were about like immunity. They were about what's the viral load? Is there a carrier status? So basically we'll just take a few minutes to kind of talk through that. So basically I'm going to probably say a few times over and over again that this thing is still brand new. It feels like it's been forever, but it's still brand new. So in terms of immunity, this COVID-19 is part of a family of viruses, the coronavirus family. And we know that at least in a season or within months of getting an infection, an acute infection, that at least for that season, we know that there is some immunity that's built up. We have to watch and wait and see what happens over the next few months in places that have kind of been through the cycle that we're currently in to see if immunity lasts. How long does it last? Is it 100%, or does it wane over time, or is it just non-existent? So that's a thing that we have to watch and wait, and just take that a day at a time. The question about the contagious period. The contagious period, the exact details, again, are kind of unknown because it can look pretty different. But there have been some studies out there in China, and validated in other locations, basically that from the date of exposure, the incubation period is from about 2 to possibly 14 days out. It's not known from what point you're exposed and how long it needs to incubate before you can become symptomatic or become a carrier and able to spread it and pass it on to people, infectious rather. So if you are exposed or you think you're having the symptoms, it's best to kind of wait the full 14 days. If someone in the house is exposed, you need to just try to like stay at home, or a family member who had something that looked like COVID to just stay at home. That 14 days, if you're not coming in contact with anyone else, if you make it for a full 2 weeks from a possible exposure, then you're probably good. If someone in the house is sick or you yourself are sick, there's a couple different guidelines, but it's kind of all saying the same thing. So if you have your symptoms, they can go on for a week, almost 2 weeks. But if your symptoms are going, when your fever breaks and you're consistently having no fever, if you make it for 3 days without needing a fever reducing medication like Tylenol, ibuprofen, naproxen, if your body kind of has fought this thing off, your fever's broken and your symptoms are improving, they say by 3 days without fever and improving symptoms, you should be okay and not contagious. For some people who test positive or who don't have symptoms, or people with mild symptoms, they say, or you don't have a fever, they say to wait at least 7 days from the start of the symptoms or whatever mild symptom that you may have had or of that positive test, at least 7 days after that before you're cleared. So it could be 3 days or 7. I think as a rule, and just to be cautious, if you wait a full 7 days after symptomatic, I think it's better because it's a little bit more, it's a little bit more conservative for you. Like you're being a little bit more restrictive, which can't hurt in a time like this. Carrier status. So the natural life cycle of viruses like this are basically you get infected, the virus replicates, you get symptoms or not, and then eventually your body does create antibodies, and you eventually can get the virus down. So the virus can completely clear your body, and you can be asymptomatic. And at that point, you're not a carrier. You will have an immunity, but a carrier is a very particular status where you're still infectious, or you have potential to become reinfectious from a prior infection. So a good example for like viral load, which was the other question I'll get to in a little bit later, but like for HIV, for example, you can get the viral load down really low, but the body is not able to clear HIV. There's these things called reservoirs where the HIV virus can live in certain parts hidden, dormant, with adequate treatment. So, but as we know with HIV, if you stop taking medications, it can reactivate. Coronavirus is not a virus that does that. And so there's not a carrier status that we're aware of. And it wouldn't really make sense that there is a carrier status. So no, I don't think that if you clear the infection, you're good. You'll probably have antibodies for it, maybe for the rest of your life. We don't know. But having an antibody for something does not denote infectivity. It just denotes some type of immunity, or more specifically, an exposure to something. The next question, and feel free if you need any more clarification to chime in a little bit, because I can further clarify what I'm saying. But the next question was about social distancing, distancing in public versus distancing in the home. So if you're distancing in the home, be it a small space, I mean, we're in New York. If you're in a small space and someone is sick in the home, but if they're, not like an intimate partner, or they're not someone who you share a room with, I think distancing is still very important in the house. We know that viruses, like most kind of like poisons or like pathogens, basically, if you're exposed to higher doses of this thing, the effect or the infectiveness is probably higher. That's why, healthcare workers, they're in the hospital, they're doing these procedures that could potentially, get this thing out in the air and activate it. That's why they need higher levels of protection, because they're exposed to higher levels. So if you're at home and you have someone who had something that looked, or it's COVID, you want to keep your distance as much as possible. You want to also do what we call source control, and even wear that mask in the house, so you can at least prevent that person who's sick and symptomatic and putting that out in the air. At least you can dampen of the virus is being put out there. So I think distancing in the home, if you can, however feasible it is important. If you are at home and someone's sick, making sure to, you want to support them. You want to try to do your best you can. You should wear a mask inside too, if someone, especially if you're kind of taking care of them and you may need to be inside the house, in their room, or you may need to come in contact with their stuff. You definitely want to, practice good hand hygiene, wear gloves. You want to, after they use the restroom, you want to disinfect with a bleach-based cleaner or something like a Lysol that has antiviral, capabilities. Basically, this distancing thing still works. So do it if you can. If you can't, you can still do things to minimize, keeping that distance, washing up, practicing really good hand hygiene while someone's sick in the house, things like that. Those are all important.
Yeah, I would also include just like cleaning off any commonly touched surface would also be super important. So for example, like multiple times a day, it's not a bad idea to just like clean off countertops, clean off any of like the sink, any door handles, anything that they might have touched, like just with gloves on, like clean it with a Clorox-based cleaner. And if possible, if you have two bathrooms, say for example, it's rare in New York City, but if you have two bathrooms, try to maybe designate one bathroom for the person who has symptoms and one for you. And like I said, just like wash it down after they use the bathroom, or also like possibly just before you use the bathroom every single time.
Yeah. It's definitely a multi-step process, but I can say from experience, I've talked, personally, I've talked to a few people through this type of situation where they have a sick roommate or a sick partner, or they may have come in contact with people. I've kind of coached people who've been infectious and just as a friend, help them through symptom control while at home. And I know it's a really scary thing, but I think we can people are surviving this, and a lot of people are, and the majority of us are surviving it. But I think at every step of this thing, you kind of have to really want to be, as on top of the situation as you can, because this is a deadly virus that's out there. So don't give up. If your roommate's sick in the house, you may not get it. So don't give up and just feel like, well, oh shit, RIP. No, like, do your best to still keep that distance if you can. If you have the privilege to kind of like, isolate or quarantine yourself away, I think, having conversations with other friends and family, that's a whole thing too. But definitely don't give up and just say, oh, I'm going to get it. I'm screwed if someone is sick in the house.
Exactly. And I would say just like be really mindful of like what you touch and like also what you use. So say, for example, maybe use the same mug that the person who is having COVID symptoms is using, use different utensils, like if possible. Like just be very mindful of like what you're doing and just what you're touching and what they might touch also as well.
The best thing I would say is probably just to use disposable stuff. If someone's sick in the house, just use disposable stuff and dispose of all, and like keep a trash bag, keep a COVID trash bag in wherever that person is sleeping. And that's where all of their stuff goes. If they're sick, the laundry and all of that also has to be washed and stuff. So you try to keep them in the room as much as possible, as much as humanly possible, just to minimize that exposure to people in that house. But keeping a window open for air circulation is also a good thing too. Any other questions from people? We have some other stuff that we can talk about too, but we can open the floor for questions if anyone wants to jump in.
Can I ask something related to what you were just talking about, living in a house, in a small house? It's New York, small apartment with someone who might have had has had like symptoms of COVID, and after like 2 weeks of them having had it, if you had no symptoms, even though it's almost impossible to not having been in touch, especially if at the early stage before they showed symptoms, would it be safe to feel like I'm having it, but I'm not gonna show symptoms?
I'd say there's a couple scenarios. You may have possibly not become infected. You may have had a mild infection and been asymptomatic. I think those are the two options. I would say either way, we know that people, when you say symptoms, the cough specifically can linger. So if everything else is gone and there's just the cough, just like a lot of other like respiratory illnesses, there can be the cough can linger. So if it's just cough and it's been 2 weeks, but you're through the thick of it, I would say, if it's just the cough, fever's broken, if you get that 3 days after the fever, or to be more restrictive, 7 days, I would say I think you're probably through the worst of it. And I think, you should still isolate just because that's where we are right now. But I think you can kind of like take a deep breath. You guys are probably in the clear.
Okay, thank you.
Yeah. Any other questions?
I wanted to ask, can I ask, sorry, I'm going to ask, but I
Sure.
think that there's actually somebody had a question. Does the washing machine, dishwasher wash the virus away?
Yes. You want soap and hot water. So the washing machine is doing the same thing in principle that you do by hand. You just want to make sure it's really hot and make sure you're using soap. It doesn't have to be antibacterial soap because this is a virus. So just a regular dish soap. You don't have to get some fancy, extravagant soap. Just a regular soap is good at cleaning.
And then when it comes to the washing machine as well, any regular soap will work. And there have been some studies that honestly regular soap, any regular cycle is going to be helpful at just killing the virus.
Sachi has a question. Immune boosting vitamins probably don't hurt. So whatever you can do to boost your immunity is a good thing. So sleeping well, eating well, trying to, trying to maintain some type of activity. Those are all things, also like the things that we put in our body, trying to limit refined sugars, eating like balanced meals, eating like regularly. Those are things that can help, and vitamins, I'm sure they won't hurt and they could help. So why not, take them?
Yeah. And so I think just like taking good care of yourself is really important at this time. Like making sure like you are very mindful of your self-care, drinking lots of water, and like, are you eating healthy? Are you eating balanced? Are you resting enough? Are you mentally ill also? You know what I mean? Like balance, like relaxing and taking care of yourself.
Yeah, I think the mental thing is a big thing, is a big help, is a big focus of this thing. And I think we all have to process this thing fully and kind of like not numb ourselves to it, and try to resist, you finding, another crutch or something to kind of distract ourselves. I think we should all totally like really feel this out and kind of like process what this all really means, and like look at, the people what is important to us, who is important, looking at what's going on politically and like who's getting saved, I think it's all just really important to kind of feel this out and kind of let that reflect in how we are governing ourselves and like, who we're considering for, in 2020, what issues should be raised higher on the, on the political front. I saw another question. I think it was about like Purell and stuff.
How well does Purell rubbing alcohol work to kill the virus?
So it works to kill the virus. So I would say use Purell if you're like out and on the streets and like coming in contact with stuff. That's the best time to use it. But if you're at home, it's better to just do good old soap and water. That's fine. Just wash your hands, soap and water. You don't need Purell in the house. If someone's sick in the house, that's a different that's a different situation, and you may want to alternate between Purell and soap and water just to kind of save your hands the trauma of all that hand washing. But basically, if you're at home, soap and water is fine. Save the Purell. You want to ration the Purell for when you're out in the streets.
I think also like furthermore, like there have been some studies that like hand washing is more effective at getting rid of the virus. So it's a lot more effective to use regular just soap and water. Yeah.
Great.
Another question?
How do you get your updates? Because you must be getting updates constantly since these constantly changes and there's always new things discovered. So how do you get your updates?
So I personally get my updates from a lot of like internal sources, but all the community facing info on COVID that's coming from the city with guidance, updates, recommendations, that's all in New York City Department of Health main website. So you just Google New York City Department of Health, and at the very top there's a purple banner that says like COVID-19. You can click on it and you can get all the resources, and a lot of the information that we're kind of presenting is all covered in that. All the new information that's updated, all the new information that comes out or that's being generated is uploaded there. It's kind of archived there, so you can follow that and look through recommendations. As more information comes back in, they're also posting more information. So within the last couple weeks, they actually started posting demographic data from people and like locations in the city of where the infection is being spread, who is getting infected. We know zip code status. I think we know. I don't think insurance status is being reported yet, but that's definitely something that people would need to see. But definitely like ethnicity data is being collected. So a lot of data is being archived at the New York City Department of Health main webpage. Just click at the very top, COVID-19. You can get all of this stuff.
Yeah, so you can see like basically like by borough, like what areas have been affected, but like Julian said, also like by zip code, what areas of like New York City are more hotspots. In addition to that, we also release like health alerts for providers and also for community members that you can read that are like really detailed on what's the sort of like the latest in New York City. I think CDC is also a really good webpage to see like what's going on at like a federal level and updates of anything that we find out. But also I personally have been checking other Department of Health websites, like say for example in Seattle, they were hit first in US. So they have a really like extensive list of resources, and they also have things in other languages, which is more than what we have for New York City right now, but they have a lot of resources there as well.
But that said, there are a lot of good resources that the city does have available. They've expanded mental health services, calling 311 or NYC Well. You can definitely get in contact with people if you need to talk to anyone. I think that they do have services for hearing impaired and people who have additional needs available. But it kind of depends on what service you're trying to access from the city. But the city does have a lot of has made a lot of those resources available. Mental health is a big one. Our sexual health clinics, if you have a quarantine day and you get caught up, our sexual health clinics are still open. There is a hotline where you can call in, and it's a telemedicine hotline, so you can actually talk to a provider. So if you have any like sexual health related concerns and you don't know where to go, the city is still trying to make themselves available for some of these services. That said, if you're going to be doing it, especially in quarantine, you definitely want to try to use a condom if you are having any penetrative sex, just because now's not the time. You don't want to catch anything that's any non-essential infections, because it's really difficult to get out. To find a provider at this time. It's like a really scary time right now. But the city, we're gonna get through this. I just think that as we are getting through this and as we're processing this, we need to really be mindful of the most vulnerable among us. I think a lot of us have personally been affected by this thing financially, and just emotionally and everything. But understanding that there's a lot of people who are a lot more vulnerable in this situation, and it's been, this vulnerability has been spread all over and is touching all of us. And just, reaching out and helping out your friend as best you can. Sometimes a phone call or text is all it takes. Sometimes, a phone call to an auntie or, an uncle or an old family member who may be really scared, and may really have, and may really have some health problems. I think sometimes just that call may be the thing that gives them that strength or that like oomph to know that, I can make it through this if I just, stay strong. So, I think, maintaining our own health so that we can be a help to others is also a big part of this too, and because, we can all help lift someone up out of this. Yeah.
Can I ask
Sure.
about plasma? And I've been hearing a little bit of people that have had to donate plasma. If you know or can tell anything about that.
Plasma as a treatment, like plasma therapy and immunotherapy as a treatment, that's definitely far out of the way. But it is a treatment that's used for other types of infections and disorders, immunotherapy. But I think it's very early in the phase, and for this thing to be if we can get plasma therapy as a safe and effective therapy, I think for it to be expanded to as much as it needs to be, I think it'll be a pretty long time away, just because the nature of dealing with with these types of substances, you're not going to be able to replicate it as fast, and it can be a lot. So it is a proven therapy for other things, and it's under investigation. But
we're a long way from where
it's a long way. Yeah.
So currently, right now that I know of, Mount Sinai is doing is studying and trying to collect plasma for people who have recovered from COVID. But it's also limited in terms of who can join the study. So you have to have a positive COVID result in order to donate your plasma to join the study. And you could check out where that all is on the Mount Sinai website. But just for example, me, I had likely had COVID about a month ago, 4 weeks ago. I was an early possible exposure. But since I wasn't able to get testing, and since a lot of people in New York City are not able to go get tested, it's limiting who's going to be able to donate the plasma, who's going to be able to join these studies. So unfortunately, it is limited because also we've been so limited in our ability to test right now in New York City.
Yeah.
Are there any questions,
Um,
any other questions from people? Oh, yes, sorry, Julian, if you want to add any.
no, I was just going to say that we do have the People's Clinic Instagram up. And I try to do a talk, like once a week. Getting ready for this, I took last week off, but, we definitely want to like keep this up, or if you guys find it useful or helpful, we'd be open to kind of come back and talk about some other stuff too, or, answer more questions. I just think the more info that we get out there to people on like in an easily understandable way, in a way that's, in a practical way, the more the better. And so, I definitely want to extend myself and, my expertise to trying to help people through this as much as possible, because, what else should I be doing at this time? Like, I'm in a weird position that I'm working at the Department of Health on this thing, and I'm, a content, not expert or guru, but, I'm here, so might as well share it. So yeah, if you guys want more,
Thank
follow
you
us
so
on People's
much.
Clinic on Instagram.
And where
of
can
course. I think,
someone support if somebody wanted to like support even economically? What is there like somewhere where people can support your work?
I think the best support is follow us, share the word. But I think, engaging in these types of conversations, like talking about it with people. And then the best way to support this work is to basically like think about how this really is affecting people, and like let it change you, like let it move you, let it, stir you deep down inside, because this is like serious times, and I would hope that we don't go through this and, and not, grow a little bit as people, as a culture, so I think that's it. But I think we want to work on more programming coming forward, but we'll see how that goes. But follow us on Instagram.
And I think like a lot of people have been talking a lot about mutual aid, specifically in New York City. So if there's something that you can do to be helpful in your community, like that's also going to be really important. Like all of us have a certain level of like, some people have a certain level of privilege, and it's, I think, a really good time to like examine that privilege and what can you contribute to be part of your community. So like if there's a food bank that you could work one shift a week at, if there is, say, donation, if you are someone that has some more economic resources, maybe you could donate to some of the domestic workers funds, or some of the funds where folks who are currently not being need a lot of help. Because I think one thing that we've seen really, really clearly is that like pandemics thrive on inequalities and on weak healthcare systems. And unfortunately, like that's what the US has in balance, right? A very weak social infrastructure, a very weak social contract. And so this is hitting people a lot harder that were already vulnerable to begin with. Yeah. And so when we talk about flattening the curve, there's also a lot of talk about like, in order to flatten the curve, we need to level the playing field, because the playing field hasn't been level for years.
Forever.
I don't think it's ever been forever. Yeah, exactly. That's what I was going to say next. And so I think if you are able to use some economic resources or spend some time, use any of your privilege that you can just to help and give some mutual aid to your community, and especially your local community in New York City.
Yeah.
Okay.
And I think also something that's really interesting is like there's still crises going around the world. So there's still, you know what I mean? Like nothing's necessarily like, nothing stopped in terms of like what's happening in terms of inequality and crisis and refugee crisis around the world as well.
I mean, yeah, we work, before all this happened, my clinic, we were like we're a smaller, medium-sized clinic, in the bureau, but we've really been, a place where we got a lot of people on PrEP for HIV prophylaxis, just because, the people who are at our clinic, there's a lot of disparity and there's a lot of need out there. So we see how a pandemic can play itself out, and even decades later, how these effects can still, be playing themselves out in the communities. And then we just get hit by something like this. And who knows going forward, 30 years after COVID, if this thing's out there, do we want these other communities to be like burdened with COVID on top of this, on top of HIV, on top of all this poverty, on top of, mass incarceration? The answer is no. But I think it's from as early as we can to kind of organize and kind of get people motivated to kind of like help move the conversation forward, the better. Because, the HIV crisis, it was years before before people kind of like even named it or even were able to like speak truth to it. So we got to be on top of it as early now in protecting these vulnerable communities, because we know that they're gonna remain vulnerable and marginalized if we don't speak up. Yeah.
And I think it's in our power also now to like create some systems of mutual care. So like, what could we do to like position ourselves so we can have better features for those who are harder hit?
Yeah, I agree. It's clear the divisions in society right now more and more. It's unfortunately even more evident.
Yeah.
Okay. If there's no more questions, I just don't want to take any more of your time. And thank you so much for sharing all of this knowledge. And yeah, possibly maybe in the future we could do another one. I'm sure that there is going to be more further questions coming up as we go along.
Oh yeah, we're definitely open to doing more and talking about a lot of other stuff.
There's a lot we've learned, I think, in the last few weeks, and I think there's a lot more to learn, so happy to do whatever we can.
Yeah, we got to start a movement. We got to get this thing rolling. We got to break this shit down and and just get people talking and have an awakening. I think people on the left and people who are progressive, we can figure out a way to kind of get our voices out there. We don't have to go and like stop traffic in Michigan, but I think there's ways that we can like, make our voices heard and let people know that like, no, like, these things are important, and people are more important than opening up this economy for people that the economy barely even served in the first place. But, that's for another session.
But it's also very clear what's the economy fucking based on. Who are the shoulders that are like supporting the economy? It's obviously the more evident now than ever. Like who's in the street working, who's in the hospital working, who's in the kitchen working.
Exactly.
Go ahead.
The bailout, like the CARES Act, the majority of the money went to private industries to like, to help stimulate their, to help stimulate them. But like at the end of the day, like that should have gone to the people who are going to be the hardest hit. I think it was like 25 million people filed for unemployment. Like that, those 25 million people need that a lot more.
Yeah. Than a multi-million-dollar corporation.
Absolutely.
Yeah, I think now is a time for people to kind of see how essential some of these protections are for people. Why don't we have universal health care? Why isn't childcare a thing? If like, what is it? 1 in 3 women work in things that are essential roles in America, but like, not to say that only women, need childcare, but just like simple things like that are available in other countries. Yeah, in this country, it's just like off the, just not even negotiable. Like seeing that those things should be negotiable, and those things should be seen as essential and non-negotiable. And like this moment is highlighting that more than ever. But I think to really get people involved, I think people should start talking about organizing and movement, and like keeping this fire, going.
I agree.
Yeah, I think it's been clear that there's never been enough protections for American working individuals, but especially for like the vulnerable population. So whatever we can do to like build new ecosystems it's only gonna help. And I think like we all need to realize that like that's the only way we're gonna get through this is like if all of us are involved and if all of us are doing something, even if it's something small. Like if we could just work together, that's the only way New York City, I think, is gonna make it through.
Yeah, for sure.
Very true. Okay. Thank you again.
Thanks, guys. Have a lovely day. Good health.
You too.
Power to the people.